What is addiction? Addiction is defined as the compulsive need for and use of a habit-forming substance that is associated with tolerance for that substance and physiologic symptoms upon withdrawal from it, according to the American Psychiatric Association. In recent years, the epidemic of drug use has increased in the United States, and it continues to rise. More specifically, the opiate epidemic. Due to this epidemic, there has been an increased number of overdoses and deaths associated with medications. As many as 130 people die every day due to overdose. Addiction involves much more than just the person themselves, though. Families and friends of these addicts are very much affected by the situation as well. In the following, you will learn a little bit more about what happens to a person who is struggling in active addiction, the types of medications that are used and abused, some signs and symptoms of someone going through withdrawals or an overdose, and then also treatment options for these people. As addiction rates increase in the United States, you may hear of more commonly used medications that people may abuse. Some examples of these medications include fentanyl, heroin, oxycodone, hydrocodone, and morphine. A lot of these medications are actually prescribed by physicians to help a person. Someone may be taking a medication for a medical reason that is prescribed by a physician, and it can unintentionally set them in the cycle of addiction. Once starting on a dose of medication, a person can build up a tolerance to that dose, which means that the amount of medication they're taking at this time no longer helps them anymore. Many times when this happens, a person will increase the dose on their own, and this can lead to dependency to this medication. When dependency happens, a person needs it to function. Cravings can be uncontrollable at this point in time. At some point, the medication will no longer be prescribed by the physician because there is no longer a medical need for it. But your body is telling you that you still need this medication. If you're unable to obtain this medication, you will go through withdrawal symptoms. Some signs and symptoms of withdrawal include nausea, vomiting, diarrhea, chills and sweats. Somebody might feel anxious or restless, overall pain and aches throughout their whole body, and even more seriously, sometimes seizure activity can occur. Fortunately, there are facilities that have protocols to manage these symptoms. They can monitor people and medicate them as necessary. Although most of the time, the thought of withdrawal alone is enough to make someone continue on using. The epidemic of drug abuse is so prevalent due to the number of overdoses and deaths associated with it. 70,237 people died in 2017 in the United States due to overdose, according to the CDC. Signs and symptoms of overdose may include a decreased level of consciousness, decreased respirations or no respirations noted at all. Someone may feel cool or clammy to the touch, and you may notice a blue-tinged color to their lips or skin or fingernails called cyanosis, which means that there is a lack of oxygen getting to the body. If a person is found unresponsive due to a possible overdose, 911 needs to be called immediately and CPR initiated. The medication that is used to reverse an overdose is called Narcan. What Narcan does when it's administered is it sits on the brain receptors that the opioid drug sits on as well, essentially stopping the drug overdose in its tracks. Narcan is actually now sold over the counter for families and friends of people struggling with addiction to be able to purchase. There are also many treatment options out there to help someone who is struggling with addiction. Treating drug addiction is a multifaceted approach. There is behavioral therapy, inpatient or outpatient treatment options for detoxification and to prevent relapse. There are recovery housing options once someone has gone through detox that they can stay at these places in a healthy environment for a short-term period. There's also medications that are able to be taken by someone on a daily basis, such as buprenorphine, more commonly known as Suboxone, or methadone. You can either receive these by prescription or in a clinic. If daily does not work for someone, they also have an injection called Vivitrol that you can get on a monthly basis that will help to decrease any cravings as well, and it actually suppresses any effect of an opiate if it has been ingested. And also, very important is support groups. They are run multiple times a day, called Narcotics Anonymous. They are very easily accessible to the public, and they're very important to the recovery of an addict. In conclusion, drug addiction is a very serious situation, and it's very real. It's becoming much more common in the community nowadays, more common than we'd like to think. As mentioned above, there are many treatment options out there to help someone who is struggling with drug addiction to go back to leading a healthy life. With increased knowledge under our belts, maybe we can put ourselves in their shoes with a little more understanding. With addiction so prevalent in the community, educating ourselves on addiction and drug overdoses could possibly help to save someone's life someday. Thank you.